I am Dr. Naveen Kumar. I am working as a consultant gastroenterologist in KIMS Hospital, Kurnool. Today we are going to discuss some aspects about IBD. Every year, May 19th is celebrated as IBD Day. So this year, to commemorate this day, we are going to know a few aspects about IBD. IBD is nothing but inflammatory bowel disease. The two main diseases that are included in IBD are Crohn's disease and ulcerative colitis. Sometimes it may be difficult to differentiate between Crohn's and ulcerative colitis. It can be called as IBD unspecified. First of all, it is important to differentiate between IBD and IBS, and even in IBD, it is important to differentiate between Crohn's and ulcerative colitis. Many people think that IBD and IBS are same, but they are different. IBD is inflammatory bowel disease. IBS is irritable bowel syndrome. There are many clinical differentiating factors between IBD and IBS. For example, in IBS, we have pain abdomen, which may be associated with loose stools or constipation itself. But IBD has more other symptoms like severe pain abdomen, persistent vomitings, bloody diarrhea, weight loss, nutritional deficiencies. All these features are absent in IBS, and because the treatment options are different from IBD and IBS, we have to differentiate it early so that the outcomes of the treatment will be better. And coming to the differences in Crohn's and ulcerative colitis, Crohn's can affect anywhere from gut to anus, whereas ulcerative colitis mainly affects the large bowel. And Crohn's has mainly more of small bowel involvement with perianal disease, whereas ulcerative colitis will have only large bowel involvement. And IBD also has extra intestinal manifestations, like some people may have arthralgias like joint pains, joint swellings. Some people may have redness of eyes, some people may have skin diseases. All these features are absent in IBS. And the ways how we diagnose IBD or IBS are stool tests, endoscopy, colonoscopy, CT or MRI. No single test can diagnose these conditions. We have to look the entire clinical history, and we have to incorporate all these tests, and then we have to diagnose. The diagnosing between IBS and IBD are important because the treatment options are different. For IBD, we need to start immunosuppressants, we need to give steroids, we need to give immunomodulators and biologicals, whereas all these are not there in IBS treatment. And nowadays, pediatric IBD incidence is rising, and the etiological factors that are told to have from the increase in this pediatric IBD are excessive intake of junk food, packaged food, ultra-processed food, and soft drinks. All these are attributed to the rising incidence of pediatric IBD. So it's better to avoid all these foods in the pediatric age group to avoid IBD in the children. So if you encounter severe pain abdomen, persistent vomitings, blood in the stools, chronic diarrhea, all these features may indicate IBD. So consult your nearby gastroenterologist as early as possible and get a good treatment to avoid complications. Thank you.